Sanibonani, molweni, dumelang, thobela, kuzo zonke nje indawo enibukelene kuzo. Namhlanje sikomnye umsitho ububanjwe i-medical and community chaplaincy kunye nombutho esiwaziyo ke eMzantsi Afrika wabefundisi who are living and affected by HIV, bekhona ke ne-Wits University, iSANAC esiyaziyo ke iSouth African National AIDS Council ibikhona nayo. Bekumenyiwe ke abantu kulomsitho o Deputy Minister of Health, MEC of Health in Gauteng. Kodwa make sizwe ukuthi le event ibingani ngoba sithola ukuthi nje ngokwe-Wits ne-Bara Hospital ibinge spiritual and chaplaincy in palliative care ngoba yonke lento inokunakekelwa kwabantu abagulayo zizifo ke ezihlangahlangene but sizwile ukuthi i-palliative care ayiyon program lapha abantu sebegula kakhulu kodwa i-program efuna nje wonke umuntu from i-diagnosis. Make singene ngaphakathi sizwe ukuthi iipika ebezikhuluma lana especially u-MEC, u-Deputy Minister kunye no-CEO we-South African National AIDS Council.
I stand in front of you as a doctor who is guilty as charged. When we go to medical school, we are taught to listen to the patients and tell them what they need. There's somebody who explained it very well. And the way we are going to turn the tide is when we slowly start to apply ourselves and say, our patients, what do they want? That's why the trend is moving towards communities leading and communities taking charge, because communities are our patients. If anything is going to change, they have to lead. So as the CEO of SANAC, just by way of background, SANAC is the highest decision-making body when it comes to matters of HIV, TB, and STI policy in the country. We bring together multiple stakeholders, government, civil society, private sector, and development partners in order to implement the response to these epidemics under one framework called the National Strategic Plan. We are chaired by the Deputy President, and the National Strategic Plan is drafted once every 5 years. I'm standing in front of you with the NSP for HIV, TB, and STI, which was recently launched on World TB Day. This is the National Strategic Plan for 2023 to 2028. I think we are all aware that as we move towards 2030, the aim is to end TB and for HIV to stop being a public health threat by 2030. So that means this is the last NSP before Agenda 2030, this NSP. This NSP we have to get right. Failure is not an option. I am standing here very proud as the CEO who led the team that drafted this, because the drama that you will see with the yellow is actually an exercise that I went through and looked for mentions, program descriptions, budgets and costs for palliative care. And each place where there's a yellow relates to palliative care. Please give our government a round of applause.
This meeting takes an added layer in significance as we will not only engage in meaningful discussions, but also celebrate an outstanding achievement, the presentation of certificates to the faith-based leaders who have completed esteemed Wits University Spiritual and Chaplaincy in Palliative Care course. This dual occasion reaffirms our commitment to a holistic approach to palliative care, emphasizing the significance of addressing not only the physical, but also the spiritual and emotional needs of individuals. It reflects our shared dedication to creative a compassionate environment for those in vulnerable circumstances. Earlier on, I was a bit emotional when I was listening to you, Dr. Mpho, because this is what I've been crying for. This is what I said we need to do in our institution. Hence, we're even trying all the initiatives of trying to assist our patients so that they can understand that they are not alone on the journey that they are taking. These faith leaders we honor today, they are demonstrating the example of compassion, example of empathy, example of devotion. They have not only demonstrated a sincere commitment to their respective faiths, but have also taken a substantial step towards becoming a pillar of strength and solace in the lives of those they serve. Through their dedication, they have not only acquired knowledge, but have internalized a deep understanding of the complexities of providing spiritual care in palliative settings.
There was a time, I can't remember, I have to document this. There's a time in the KwaZulu-Natal, there was a big accident where a truck went down at Pinetown and actually crashed 2 Kumbis. And we had a lot of people who died there. And when they were actually trying to count people, they actually got it wrong initially, because when they found the leg the other side and they found the other arm that side, they thought they were counting 2 people, and that it was, after everything was collected, it was 1 body. So the numbers actually were corrected later. So because because also my training, I also went to do a training in this course of forensic pathology services. I also can do postmortems, and that's why when my MSc was in trouble, I said, look, if you need, and she had really organized very well after this disaster, I said I was available to come and assist. So one of the workers in that forensic pathology services in Pinetown called me and said, Dr. Lomo, we really have had this big accident yesterday. We really, not this time to come maybe and do post-mortem, but to just come and comfort us and counsel us and just take away this pain that we have. You know, poor me, I said, I'm not coming there. I can't just look at those bodies. I just don't, I'm too traumatized. I saw it on the TV, it's enough. I'm not coming. The reasons I also said, no, I said 2 weeks ago, I had been to another part called Ndundulu in KwaZulu-Natal, where the maidens who were coming in from Mshanga, there was an accident. A bus also crashed, and I was physically there collecting the bodies of young girls into our forensic mortuaries and getting them there. So I used that as an excuse. I said, look, hey man, 2 weeks ago I was in Ndundulu collecting the bodies of these young maidens who had just been crushed by the truck, and therefore, so this guy was engaging. He said, oh, Dr. Lom, you are exposed to one big accident and then you are done. What about us who get exposed to all this every day? You know that thing, it just changed I just dropped everything down, said I went. So I'm saying you will not realize, MEC, if we make a visit, which you are promising me we'll do, to some of these colleagues who have just been doing the postmortems, who collected the bodies from the flat, from the building that was burning, just your visibility to them, just sit around the table and just thank them and have coffee with them or water. It will go a long way towards actually improving their spirituality. And that's all that they need. So I'm really saying we don't know how much we can do to support our people there. So I'm just beginning to prepare all of you to say you don't underestimate yourself. What you have already acquired here today goes a long, long way towards actually improving the quality of life of other citizens. Now, because I thought my MEC has spoken a lot about our, I'm going towards the last part.
Hayi ke sibazwile ke uDeputy Minister uMEC kunye noCEO weSANAC bekhuluma bebeka bevumelana nereport ibinikiwe nguDr Mpho walaphaya kwiUniversity yeWitwatersrand. Masibuya ke breakini ke bengifuna ke sikhulume nabantu esinabo la estudio engibahlonipha kakhulu abeze nawo lo mbono wokuthi kutrainwe ama-faith leaders in South Africa. Basiyakhumbula abefundisi before bebesikade sisiya emawodini siyothandaza laphayana sikhale ngofire HIV come out. Uthola ukuthi manje yonke lento esenza though bekusuppose ya appreciate but si disclosure izigulo zabantu singayazi ukuthi si disclosure izigulo zabantu, but abefundisi manje baya trainwa ukuze sibe zi professionals masidila ngempilo zabantu. Angihambi ngedwa ke uDr Mpho mhlambe uzoyichaza kabanzi. Dr Mpho ngicela ubingelela abantu lapha emakhaya usho nokuthi why the program is so important. Ngoba ngizwile ngo deputy minister kuthiwa kudala wayiqala lento.
Allow me to also intermingle with English. The palliative care deals with people who are very sick, but we need to start when people are diagnosed. Whether you are HIV positive, or whether you have TB, whether you have cancer or other chronic illnesses, you need palliative care. So we will then work with the doctors who are treating you. If you are HIV positive, you are on antiretrovirals, palliative care will work with you and your doctors. Usually what happens is that as the disease progresses, but one now worse, more palliative care is needed. And because palliative care in a number of aspects, we don't work alone as doctors. We are trained to do the physical issues, refer the injections, refer medication to prescribe, but we also need nurses. We need the social workers who will deal with social issues, both stigma or disclosing to family. You need social workers to be able to help you. When someone gets very sick, banally social issues, banally loss, ya the role sometimes we have people who are very sick, they can't bath themselves, they need someone to bath them. We need social workers.
Before mhlambe ngiye ku chaplain uMacy, uthema ukhuluma la ngaphakathi waveza evidence yokuthi abantu aba spiritually connected baphila longer than abantu abangekho spiritual connected. Can you explain that kubabukeli lapha emakhaya?
The research that we did here, the cancer patients, showed us, because when you do research, you need to be able to make sure that you do things right. How reporter, people will be able to check, is your research in integrity? So we're able to prove. Patients who are receiving spiritual care, in the case here, the cancer patients are on. They lived 83 days compared to those who did not receive spiritual care, who lived for 50 days, which is about 2 months.
Yeah.
Just less than 2 months.
Yeah.
So the benefit of spiritual care goes even beyond that.
Yeah. Mangiza kuwe manje ungathi mhlambe mawukhuluma nabantu lapha emakhaya uthi isize ngani le program yokutrain kwama faith leaders as chaplains? Mhlambe usinike nje nesithombe ukuthi beqalele kuphi uze nalombono.
Okay, dumelang, ngiyabulisa. I'll just speak in English and I'll change languages as well. I-program may start, baba. Njengoba ngishilo ukuthi I was just a frustrated nurse because I was expected to do the work of a pastor that I was not trained for. Kumbula ukuthi abantu mebagula esibhedlele, especially when one has to die. The family will be there. They want us to have time to be compassionate, sibaduduze. But my work, ngibizelwe ukuthi ngibhekane ne-patient, mase shonile patient, msebenzi wabo social worker nani lezi ukuthi kuzofanele ngiyeke amanye ama-patient ngiyothandaza manje ngibe lapho. I'm not trained for that.
Yeah.
And because sisebenza ngabantu abashonayo, I worked in the medical ward for a long time. Sometimes kufanele ukuthi nirephe 4 or 5 corpses in the morning. Sometimes mawuyenza i-night duty. Remember now umuntu now conscience may say is sealed. Sometimes you'll be surprised on our attitude as nurses singathi si treat abantu senza ngesikhathele. Uyayibona leyo nto leyo. I-pain leyo ukuthi uzawuzola omunye umuntu, it's like ngisemsebenzini la. Fanele ngiphushe i-routine.
Yeah.
So I went back and checked at the definition of health. Health is a complete state of physical, social, psychological, and spiritual well-being in the absence of the disease. So when WHO and Department of Health conclude that that's the definition, then that means there's something lacking. Why spirituality singanabantu practice? Because we've got social problem for social workers, psychological problem for sinanama psychologists, futhi ba-employ labantu laba. Then sinanabo Dr. Natamanes. Why laba spirituality bangekho?
Yes.
So I think that was the problem. And coming again to the community, we've seen that most of the diseases, they happen in the community.
Yeah.
Most of the esibhedlela so uya waqala esontweni waqala ku traditional healer waqala somewhere. So why prevention is not done in the churches? Sikhe sichange ukupreacha ngabo bani nabo bani sikhe sifake ne health issues lapho. And nezinto zama stigmas ziqala khona lapho kule religion and faith. So I think we need to change the way we do things, especially when there are outbreaks lapho kuzothi abafundisi naba traditional people babe involved, but really we are involved at the last instead of prevention.
Yeah, makasambe seyitolo masibuya ngifuna sikhulume ukuthi le program ihamba kanjani and ningathini kumphakathi ukuthi umphakathi mhlawumbe ungalekelela kanjani, also nokuthi mhlawumbe sisho ukuthi ingaba befundisi ba respond positive or kune resistance. Stay tuned. Igama lami ke Dingumbulelo Tyasi. Ake njengoba sibuye itolo bengifuna ke mhlambe siphinde ke singene ngaphakathi ngoba kuyashisa lapha, iziningi izinto ezikhulunywayo and by simplify science. That's what I like about this program. I call biomedical, kukhulunywa ngezinto as practical. Maka singene ngaphakathi sibuke.
That it is in the interest and mandate of the South African Police Service that we need to create partnerships with the communities, and there's a spiritual crime prevention which is in motion, where the faith-based organizations, the community pastors and everyone is allowed to work in our space, and which is to work together with communities in making sure that South Africa is a safe place, and through a divine intervention. And we have a program called Spiritual Crime Prevention. But that's not what I'm here today for, but I'm here to give you a support and to register my support and my indication that we are with you. Why are we here? It's because we realize that the church is no longer relevant. Why I'm saying the church is no longer relevant? Because one of the writers, Matt Coate, said the world has gone mad and so has the church. One of the writers says the church has gone worldly and the world has gone churchy, that you cannot notice the difference between the two. There's so much politics in the church more than in parliament, where there's supposed to be politics, but we find more politics in the church more than in parliament. So I realized after studying and engaging in a study, when I did my honors in theology with the University of Pretoria, and then when I majored in practical theology, and then the practical theology says is the actual experience and needs of communities. That's where we realize and we activate and we make sure that we engage in making sure that we care for the communities. And if I may say, a chaplain is somebody who is a pastor. Some are not pastors. But when you are a chaplain, you need to understand and to come to an understanding. You forget about the doctrine of your church. You forget about your rank in church and you become what God has called you to be in the community, because sometimes we are misled by the four walls in the church and we think that our ministry iphelela enkonzweni kuphela, but we need to understand that there are those who need us most. And why I'm saying this is because there's more pain outside than in the church. So that's where chaplains come in. Why I'm saying this is because I realized that me in the South African Police Service, my job is to take care of the police only. And when police members and people who with GPV, people who are suffering and people who are abused come to the church office, what we call customer service center. When they come there, they report a crime, maybe of gender-based violence or abuse. And they find a policeman who would say to them, no, there is a victim support center, Lapaya. So you can go there and rest for the night. And then after resting for the night, you need to give space for somebody, a new case that will come tomorrow. So my question is, the chaplains in the South African Police Service and other military services are only working together and are only giving their service to their own. Why I'm saying this again is because there was an incident where a woman was hit by a truck. And when this woman was hit by a truck, we were there to support our own. But supporting our own again, we need to also look at the community and help the family of that woman. And then my question is, what is a follow-up principle after that?
Dr. Mpo, masibuya ke manje bengifuna ukucheck ukuthi where to from here. Are communities responding well? What is the response yabefundisi especially?
Abafundisi, I think for the training, we've had a good response.
Yeah.
And they are able to realize that they need to do more than just praying and preaching.
Yeah.
They are receiving the knowledge and the skill for them to be able to address the needs of the patients. Mm-hmm. So the communities must be aware that as we move forward, we are hoping that the Deputy Minister was here, the MEC was here, we are hoping that as we move forward, spiritual care will be accessible within the healthcare settings, from the hospitals like Bara up to the home of the patients.
Those who want to register, there are a lot of pastors who phoned me yesterday, they want to know where to register.
Okay, I think we'll send the link, or you can just Google on the Vets University website. Okay. Just look out, just Google Vets Enterprise. When I'll do short courses there, then you'll be able to find the introduction to spirituality and chaplaincy.
Okay. Chaplain General, from here where to hotel?
From here, I believe with your assistance, because we were just doing their training pockets and pockets, that we shall reach more. Because Abafundis, they need a course. And those who have attended, they've seen their importance. We really need you in the hospitals. It's not nice for hospital to allow few. If you utoge regalia, then the security does not disturb you. But when you are coming with a suit, they don't even understand what you are doing there. And Mpakati futhi indaba yama visitors hour, because you'll find good is Sunday. Wonke umuntu patient eziyagula ziyapeyinwela kuza lo sonto kuzokupreacha it's like you are competing. So we are trying to professionalize this so that people can be even accountable in what they are doing or what they are saying to the patients. And nobody must just jump in afike akushumayeze. What if you don't even believe in that? So people, they have to learn on how to do this. In closing, I will refer them to the book of Matthew 25 from verse 31. Uthi uYesu Jesu enemakaza, there will be 5 questions they will ask. Who's that? I was hungry, I was thirsty, I was in prison, I needed home, I was a stranger, and I was sick. Did you visit me? So yiyo lento la ikhulumayo. So community belongs to us. We need to go there and do the works of God.
Babukeli makhaya singakhuluma kuse kodwa iningi lesifundile namhlanje but okubalekile befundisi niyazi ukuthi kunendawo lapho ningatrainwa khona so that umphakathi uqala ukusithemba singabefundisi. Igama lami ke ndingibolo Jasima ngithi nje nonke emakhaya ncinzelile.